Hello, hello. This is Vincent for Tiksu to UniTartu, and today is going to be all about healthcare in Estonia. I'm joined by Sandra, and she works as a nurse at the Estonian Health Insurance Fund. She's going to give you some in-depth information on managing general health, struggles of finding a family doctor in Estonia and how you can navigate it, and what you can expect in terms of cost for healthcare all across Estonia. So please enjoy this episode of Tiksu to UniTartu. Sandra, would you like to introduce yourself?
Hello, I'm Sandra, like Vincent said, and how I'm connected with healthcare in Estonia is I'm a nurse, and I also work in Estonian Health Insurance Fund.
Can you maybe tell me a little bit more about your background, how you got into the field?
Yeah, actually when I was a child, I was so sure that I'm going to be a doctor, but I actually studied to become a nurse. I don't know why. And I have been working as a nurse for 12 years. And actually, I'm going to have a night shift today. When few years passed, I also thought why not to do a master's degree. So I studied a healthcare organization management, and that's how I ended up in Estonian Health Insurance Fund.
So you are an expert on the management side and the practical side.
Yes.
Okay, well then we have the right person. So can you maybe tell me just a little bit more about the baseline of Estonian healthcare? Like what is it for the average person here?
Yes, actually our healthcare insurance system in Estonia is very easy and logical, but it has some difficulties, and that's because of the human factor. Mm-hmm. I will explain it as we go along. But first thing, when you come to Estonia and you're thinking about the healthcare, you need to do three things. I hope you have heard about them. Yes. The first thing you need to have is a temporary residence permit or living license, how someone call it.
TRP, I think, is what they're calling it.
Yes. The second thing you must have is a health insurance. And for that, you can do it in Estonia. We have many insurance companies that offers the policies, or you can do it in your home country, and you have to make sure it extends to our country. And the third most crucial part is you have to have Estonian registered address. If you have these three things, you are actually good to go.
Well, there you go. I've heard it's kind of difficult for some people to find a family doctor, and that's one thing that you should do right when you get to Estonia is find a family doctor. Can you maybe explain a little bit about that kind of difficulty?
Yeah, family doctor, family physician, both are correct. Why it's so important is actually our health system is built up this way that the family doctor is your first contact if you have any questions or problems with your health. Getting sick or just want to extend your recipe or something, that's family doctor job. And that's why you need to think about it when you move to Estonia. It should be the first thing to do. Mm-hmm. And it is difficult to get a family doctor because mostly our doctors are close to the age where they go to retirement. And this is actually the challenge that Estonia is facing, like other European countries. Because of the democracy.
I've heard even for Estonians moving to a new city, it's kind of difficult to find a family doctor, and for foreigners, it's probably even harder.
Yes, for foreigners, it's even harder because the language barrier. This is the second thing that makes it difficult. These are the two human factor things I told you in the first.
What do you think somebody can do to maybe help out with that language barrier? How can they get a family doctor if they don't speak Estonian?
Yeah, the correct answer is that you can always hire a professional translator and you can sign a confidentiality contract with him or her. The second option is to have a good friend or colleague in Estonia who you trust your personal information.
But that also involves meeting an Estonian and becoming friends.
Yeah, yes, yeah. But Estonians are usually friendly people if you're getting to know them. So I think they will help you out. And the tip to make sure you get a family doctor is you actually should make the first contact with your family doctor in Estonian, if it's possible. If you write him or her, please, here is my paper, please accept me in your patient list, or when you call, it should be already in Estonian. Then that gives the doctor the confidence that, okay, he or she will manage.
Yeah, so do you just call them up and to get on the patient list, or do you have to fill out an application? Is there some kind of waiting list also?
You have to fill up application and sign it. It's preferred to be digitally signed and sent to email. But you can also call that I am looking for, are you willing to, I would like to send you my application. And if you do it in Estonian, or you say, I have a translator, don't be worried, then it might be go a little bit easier for you.
Are there generally vacancies for these this family doctor's patient lists, or is it kind of hard to actually get on the patient list?
In Estonian, the patient list maximum number is 200, and most the patient lists are very close to 200 or over. So the doctor who has patients over 200, they can say no. It's in law. But those family doctors who have patients under 200, they actually have to take you in. But of course, they are a little bit overwhelmed and frightened about the language. So there might be needed some explanations and some letter sending before you get exception. Yeah,
are the appointments kind of few and far between? Have you had any experience with trying to get into a family doctor, or maybe do you have the inside scoop since you're a nurse?
As a nurse, I don't have context, and I also can't do the recommendation, but due to my other job in Estonian Health Insurance Fund, my specialty is primary care, and that means family doctors and the patient list. So actually about 5 letters from patients, usually for Gagans, come to me. So I have to take care that they get the family doctor. So I'm always on contact with Estonian family doctors, calling them or writing them, please accept, why you don't, take down the fears.
Yeah, you're there at their door knocking.
Yeah.
Are there like any alternatives to a family doctor? Let's say, you call up your family doctor, there's a appointment 2 months away and you need to see somebody prior to that.
If you have family doctor and you are very sick, then actually family doctor have to take you in the same day or the next day. But if you haven't had the chance to find yourself a family doctor, or you just forgot it, that's also fine. Then your other option is, if you are capable of, go to the pharmacy shops, and our pharmacists give you the help and recommendation, what medicine or what you should do. The second option is just go to the private clinics if you have the resources for it, because you have to pay all of the visit.
Yeah. My personal experience with it is that I've actually never been to a family doctor here. So far, I've been lucky enough to be in good health. But the pharmacists are very knowledgeable, and they're always willing to help you. I think it's more than in the States where I come from. It's the pharmacists are kind of just there to sell you pills. Here, they're actually kind of much more knowledgeable.
Yeah, they are actually giving you advice and recommendation what you should do, what you should expecting of or not, and when you should go to the ER or not. They're actually very professionals in Estonia. Yeah.
Is there like maybe you don't know, but is there a certain qualification to become a pharmacist here?
Yeah, we have a special study in Estonia. Yeah, you actually get the certification for that.
Okay. Let's talk a little bit about emergency care. Let's say somebody breaks their leg and they need care right now and they go to the hospital. What can they expect?
What's good about Estonian healthcare is actually if you have emergency, that means you have a medical condition that needs to be treated right now because it's life-threatening, or it might be get life-threatening, or it has the time limit, then the medical care is free to everybody.
Oh.
It doesn't matter what is your nationality, or do you have health insurance or something like that. That doesn't matter. So the emergency care is free to everybody. So if you have broken leg and you don't have the health insurance, that's okay. You go to the ER, they are treating you the way it should be, and they are sending the documents to your home country. It's the higher department's business.
Are you paying for anything like x-rays or anything kind of in between, or are you walking out of there with a $0 bill?
You walk out about €5
Oh,
pill.
wow.
Yeah, it's just symbolic number, and the €5 is in every doctor's visit. Only family doctors don't have it, but other doctor visits is €5, and that's it.
Oh, that's pretty convenient.
Yeah.
So in terms of dental care, is it the same as the healthcare? And what does somebody do if they need dental care?
Yeah, this is I think the hardest topic in healthcare in Estonia, because in dental care we all pay, also Estonians.
So there's no dental family doctor.
No, you can just get this kind of health insurance that covers the dental problems. But if you just don't have it, or some Estonians also haven't made the insurance for the dental problems, then you just pay. If there's all is good in your mouth, then you just pay €5 and you just have the checkup.
Yeah, I've noticed a lot of people don't have dental care. Like, does employment usually give dental care, or is that not something like an employment coverage?
Employment coverage means that your employer register you as his or her company employee, and they pay social taxes for you, and if they pay the social taxes for you, then it means you already have our health insurance, and that covers all the basic things and all the things we already talk about, but it doesn't cover the dental problems.
So I mentioned employment. Are there other benefits that being employed can have in terms of your personal health?
It might be that some organization offers you the dental care. It might be or might be not. It depends the organization. Some organization gives you the STEBI. It's web environment where you have your account, and your employee gives accounts their money, and you can go to sports centers.
I've seen some pretty creative uses of STEBI. I've seen somebody say, they get 3 massages a month from STEBI. It's pretty wide, yeah.
Yeah, but you have to be sure that the massage is...
it's under the coverage, right?
Yeah, under the coverage. It's not like some with hot stones or something. Like it has to be massage for your neck or back. It's
it's not just you go and get a massage for fun.
It should have some medical, attachment.
What are some of the more out there ones you've seen? Do you have any coming off the top of your head?
You mean using the STEBI?
Yeah, using the STEBI. That's been covered.
Yeah, I covered. I don't know. I think the organization are actually looking what people are doing or how they are using it. But I know that one of my colleagues asked about the manicure. And is it okay?
Hey, that's nail health.
Yeah, but of course they said no.
That's a bit unfortunate, isn't it?
Yeah, for women, yeah.
So kind of switching gears a little bit here, I want to know a little bit more about the emergency numbers in Estonia. If somebody's in danger, they need something, poison control, whatnot, who do they call?
Yeah, actually I'm good you asked it, because I already forgot it. In Estonia there are 4 numbers. I think everybody should know, especially those who come to Estonia. If you have emergency, or you need police or fire rescue crew, you have to call 112. And they are usually speaking in English also, so it's not a problem.
I actually called 112 for the first time. There was a car behind my building that was on fire like a couple weeks ago. Well, maybe a month ago, but I called it for the first time and I was kind of scared. But they did actually speak English and it was very, very helpful. So.
Yeah, okay, very good. You have the good experience.
That's the only number I've called so far.
But if you have a health concern or you just need advice and it's evening or weekend and your family doctor doesn't work anymore because the time is out, then you also can call to a family doctor counseling number, and it's 1220. Mm-hmm. And it's 24/7 and it's also free. Mm-hmm. Also, women may need pregnancy consulting.
Haven't had experience with this one, no.
Yeah, but if some students need this kind of help, mm-hmm. and also out of the working time, then we have a midwife calling counseling number, and it's 12252.
Does that also include like infants as well for help with them, or is that just for?
Yes, of course. If you already have a little child, you can also ask about it if he or she is ill or you have eating problems.
Yeah, I mean you're probably more experienced, but having a small newborn kind of scares me. It's good that they have a number for it.
Yeah, we have a number for it, and you can also. I use this number because I need some advice about the breastfeeding. So it's free for everybody, and they do answer about all the questions you have. Mm-hmm. Yeah, and the third, I think it's quite important number in Estonia, is when you suspect poisoning, you or your close ones.
That's when your infant grows up and they drink something under the sink.
Drink or eat. Yeah. Flowers are poisoned. Mostly infants eat flowers, toddlers.
True.
Yeah. And if you just want to get advice or you want to know what you should expect or look out, or when you have to go to the ER with a problem, then you can also call the number 16662, and also it's free, it's open at 24/7, and all the 4 numbers is answered by doctors or nurses.
So somebody needs to find these in a hurry. Where can they look to find these 4 numbers?
Yeah, the quickest way to find the 4 numbers is go to website eesti.ee, and you can put it in English, and then you find all the information under the family doctor's step.
Great. So I wanted to ask, China, just winding down a bit, are there any more tips or resources you have off the top of your head for somebody that's about to come to Estonia and just to give them some peace of mind?
I think but students or just people who come to Estonia for a longer time than just a vacation 1 week.
I mean, I think it's also a good idea to touch on students, maybe some challenges or tips just specifically for students.
Yeah, I think the hardest part is, like I already told, is the language barrier that might be, especially when you're finding family doctor. But also, I have heard that people think that I'm not a very sick person. At home, I was good all the time, and in Estonia you might get sick. Yeah. Because we have 4 seasons and our winters are cold, so the flu and viruses are very common things for us.
Yeah, especially people coming here not expecting the cold.
Yeah, especially when you're coming from south where it's warm all the time. So getting a cold is a very, very common thing.
I actually have a friend who's from the south, and it was her first time ever seeing snow and first time with ice. And she fell and broke her wrist falling on some ice her first 2 weeks here in Estonia. And then a month later, she did it again. But a little bit different situation. But she was pleasantly surprised that the healthcare system was as convenient as it was for her for emergency care. And when, as a matter of fact, when she went there the second time, they already had her insurance plugged in and everything, so she was already kind of good to go and in and out pretty quick.
Like everybody knows, Estonian IT department is quite developed, so it means if you once have visited our hospital or something, the information stays there, and if you go, I don't know, another city and another hospital, they also get the information out, so it's quite good.
I guess it also kind of brings something else to my mind. Do you have to pay for an ambulance here?
No.
No, really?
Yeah, actually, I am a nurse and I work in ambulance, so it's also free. Even if people call us because of the, I don't know, flu, which is not actually the emergency care department, we still go out, we looked for the signs, give some recommendations, and we just go out, and it's free.
Okay, I maybe have one last question for you. As a nurse, what can somebody coming to receive medical care, what can they do to make your job easier?
The easiest thing for me as a nurse, and especially when I work in an emergency department, is to follow the system, the steps we have given you. It means please find a family doctor and let him or her advise you from the basic things, so emergency department nurses and doctors don't have to deal with the high fever and so on, or on treatment conditions. Also, go and get advice from the helplines I told you, or go and ask from pharmacies how to treat some problems, and call emergency number or ambulance, or go to the ER only when it's life-threatening or it's possible that it gets life-threatening situation.
So basically, be prepared before you actually need it, right?
Yeah, follow the system, get the information, read about it, and really good is if you follow the instructions that the people give you.
Well, I think that's all the time we have, Sandra. Thank you so much for joining me, and thank you all for the great information you've given us. Is there anything you want to add right at the end, or maybe some kind of resources you forgot to throw in that you'd like to let everybody know about?
I think we covered all.
Awesome, great. Well, thank you so much for joining me again, and this has been Tiksu to UniTartu. Thank you again for tuning in to another episode of Tiksu to UniTartu. We hope you had a chill time with us. Make sure to follow the University of Tartu social media channels on Facebook, Instagram, X, and LinkedIn. And if you have any questions for us about the podcast or topics you'd like us to cover in the future, then let us know. And this has been Tiksu to UniTartu.